Today's video is what the experts say about who has the world's best healthcare system.
We are Greg and Lisa, an American couple living abroad in Spain. And if you are into exploring the crazy, funny, surprising differences between the U.S. and Europe, you came to the right place.
Yeah, and this is going to be interesting because we've experienced the healthcare system in both the United States and Spain. So we'll see how this goes.
Yeah, we'll see how this goes. So this right here is the Washington Post. We're going to subscribe. We're going to do that there. And then we are going to see what happens here.
I want to start with a simple question. Which country in the world has the best healthcare system?
Oh.
Yeah. So I hate that question. Here's where you should ask me why I hate that question.
Why do you hate that question?
I knew you were going to start with that question.
I think it's a question that a lot of people ask. Which country has the best healthcare system? And
I don't think there's a correct answer to it.
It depends on what it is that...
Oh, I was like, she looks familiar.
Oh, she does look familiar.
Yes, I've seen her on the news.
Oh, okay. And so far, all these people are from America.
Oh.
Like Baltimore, Austin, it looked like.
Interesting. Well, I mean, it's Washington Post, so.
Oh, yeah, okay.
that we value.
I'll give you an answer, but then I'll tell you why the answer might not be applicable. If you look at the world...
What?
Okay.
So they all don't want to answer.
No.
Because they know what they're about to say.
Yeah, I don't know why they don't want to answer.
I don't know.
Too many variables?
Rankings, the country that came out on top is France.
Spain. Oh.
I think in general, starting from France and working northern, you tend to get the best healthcare systems.
Oh.
But the reason why it's not entirely applicable is that what works in one country may not work in another country.
So what works in every country is keeping people healthy and saving them from dying. So, but I guess there's different ways of doing it. So maybe that's what he's saying.
Maybe.
Yeah, they're just afraid to say what they really... Let me stop judging.
That's
You got nice shoes, though. I ain't gonna lie.
Oh, okay, yeah.
So a number of years ago, just a few years ago, I wrote a piece in the New York Times with my colleague Aaron Carroll. We actually did a tournament of health systems. It was like a bracket tournament, the way March Madness is a bracket tournament, or like a tennis tournament. And we had me and Aaron, Uwe Reinhardt, Ashish Jha, physician, now Dean of Brown, and Craig Garthwaite, an economist at Northwestern. And we each voted in each of the brackets, like in each of the pairings, for which system we liked better. And then we ultimately got a winner. But one of the important takeaways from that whole process is that in no pairing did any country win 5-0. There were 5 of us, right? We were not unanimous in any decision. There was always at least someone who disagreed, and in many cases it was 3-2. And we each had different reasons. You know, someone was very big on like the cost, equity, access, or the quality. And so to me, look, this is 5 people who know healthcare pretty well and know these systems pretty well, and we couldn't even agree. So there's just no clear winner, actually.
I can see that.
But the one thing that stands out is that among all major developed nations, it's pretty clear that the United States comes in dead last.
Yeah.
On the other hand, I think everyone, especially experts, should be skeptical that they know the answer. Because what works in one country or one setting doesn't necessarily work in another.
So, you know, there are aspects of the Australian system I like. There are aspects of the English system I like. But I don't think that there's a system we could just bring over here and install like a new.
So every system has its flaws, just like in Spain. I'm sure we think it's great for what we're looking for.
Right.
But other people have problems with this or that.
That's true. I mean, but I would imagine that it is an individual experience.
Yep.
I would agree with that. But then I would also say that there's some like core things that everybody probably wants.
Yeah.
They want
availability,
cost. They want low cost of prescriptions, not have to worry about that. They want to be able to go, because you can't choose who's going to get cancer or what's going to happen. So, if you're not a wealthy person in America, you're screwed, basically.
Right.
So that's the bottom line. Or you got to make sure you get rid of all your assets so you can get Medicaid. So that's, it's a disaster.
That's true. That's true.
new fridge.
So maybe the better question is, what would the best system for the US look like?
And what would that look like?
So a good healthcare system, or let's just call it a healthcare system. A good healthcare system has, I think, to me, several attributes. One is,
how does it affect our health as a country?
Yeah.
How long is it that people are living? What is the infant mortality rate? What is the rate of certain types of diseases, and how well are they doing in prevention?
And the second question I'd want to know the answer to is, were the benefits of the treatment greater than the cost of the treatment?
A bad healthcare system could have overspending on care that's of really questionable health benefit at the same time that it has underspending on healthcare that's of vital importance to people. So when people say, do we spend too much on healthcare? We spend way too much on some things and way too little on others.
Well, one of the reasons we spend way too much on healthcare is because the cost of everything in America is way too expensive. The same bottle of insulin that you get in America for $80, you get the right politician in there, it can actually be $35, which means that the cost of that thing stayed the same. It's just a matter of opinion on who has the influence to make sure it costs more or less. Sorry.
So a good system would fix both problems.
And the third dimension for a healthcare system is, how well does it reflect our values as a society?
And by values, I mean,
he said the same thing.
What are the rich willing to do for the poor? What are the healthy willing to do for the sick? The answer to that doesn't come from economics. It's an answer that we all have within us.
Right.
But that answer profoundly affects how you answer questions about what's good and bad about healthcare.
It's 100% true. That is the answer right there. Because what you find is, man, I'm like really preaching today. But
go ahead.
But I mean, basically what he's saying is, what we have in America is we have a lot of people who say, I did it, so you should be able to do it too. I picked myself up by the bootstraps, and I look at me. I have all this money that I can afford my health care. It's not my problem that you can't. So that's exactly what he's saying, is that what are the rich people willing to sacrifice, and what are the healthy people willing to sacrifice? So it's a great question, man. Good job. Okay.
And I would hope that going forward, as we think about the learnings from other countries, we can take a hard look at what it is that we have and whether they align with our core principles that we otherwise hold so dear.
So my goal is have a health system that does the most it can to improve our health, that protects people from financial ruin, and that conforms to our values as a society.
Right.
So that would be the right thing to do in principle. The next question should be like, can we get there from here? And I just don't see it.
No.
What we've seen over time is that,
it took, I don't know if everyone knows, but it was like pulling teeth to even get the Affordable Care Act.
Yeah.
Because that was too socialist, too universal.
Yeah.
Universal.
it's political. It's a long, deep history to it. But
that the costs of healthcare have gone up, but outcomes have also improved. So if we take some measure, and the measure that I like to use is life expectancy at age 40. And then I look on the other axis at the cost of healthcare per person. And what you find is, if you look back to 1976,
all of these countries, the US, Germany, Canada, look similar in terms of what share of GDP goes to healthcare.
And they are all people are living about 35 years after age 40. Okay.
Fast forward 20 years, and the US is spending a lot more of its GDP on healthcare, and its life expectancy increases have not kept up with the life expectancy increases in other countries.
So the US becomes increasingly an outlier, both in terms of outcomes, that is life expectancy, and in terms of spending.
Well, that's because healthcare, what we've learned, it's a combination of lifestyle and your ability to get healthcare. So if you give people the ability to get healthcare, but they're building more fast food places, They've made certain things that are not good for you better. They've had commercials about bigger portions. Like it's just, you know.
The toxins in the food that are poisoning us. Yeah.
Now, you can put the two on the same graph, but that doesn't mean that they're related in any way. I think we're simplifying the other healthcare system to the point of getting it totally wrong. But a lot of it depends on who you're talking to, right? I think there's a view that some Americans have that in other systems care is terrible. You know, there's very long waiting lines and waiting lists, that the latest medical technologies are routinely not available. I think for a lot of other Americans, there's this view that other countries have just figured it out. And what we should be doing in the United States is copying what they've already figured out. And I think both those views are not right at all.
So I think people mix up this term called socialized medicine with...
I mean, I feel like he's saying they're not right, but there's a little bit of truth. It does take, if you're on the universal health care out here in Spain, it does take a long time.
Right.
If you're on private insurance, which is very cheap out here, it's cheap in comparison to what we're used to in the United States, it being $200 for 4 people. It's a much faster system. But on the universal, we do hear them complaining. Yeah.
I mean, they do complain, and I can see some of the complaints that I hear in America saying why they don't want universal health care. I see those things here. From my perspective, I have worked in Medicare before. I think one of the benefits of having the universal healthcare system out here is that when you get people that are 60, 70, and 80, you know, they don't have to choose between, should I eat dinner or should I take insulin? Should I cut my pills? And like, I know I'm supposed to take 1-2 pills a day. I'm just going to take one because I can't afford it. I don't want to run out, you know. So
and you guys may think that that's like cliche and that's just what people say, but Greg hears it. And he like literally hears it.
Yeah. Look, we are just talking in this one. We sorry, okay? We're just really talking. Okay. And I know some people out there mad, got an opinion, think we crazy. You can put it in the comment. It's okay. We will understand. Okay. We all have a difference of opinion. This is our opinion, and we're glad you're here watching with us. Yes. Thank you very much.
With what I would call universal health care.
One is the insurance part. That is, who runs the insurance, and you can have socialized insurance where the government is running the insurance, or private insurance where private companies, or both. And then second, there's the providers of medical care, who could be either government-run employees or private employees.
There are some methods that one could classify as being socialized medicine, meaning that the government is a single payer, the government operates all the healthcare, and people belong to a single government system.
So Britain has socialized medicine because the hospitals are government institutions and the physicians and nurses are government employees.
And France has yet a different kind of a system, also not government owned. And Switzerland, Netherlands, Germany, these are places that have universal health insurance, but they have active and important private health insurance companies that administer it. So very different structures of these systems. The thing that they share in common is that they're universal.
Right.
So I think, coming full circle, my great worry with healthcare reform in America is that it has collapsed to the level of kind of fighting and arguing about these slogans. And the slogans have nothing real behind them.
These slogans have become so politically charged and tied to a particular candidate or a particular viewpoint that has become completely partisan and will shut down constructive debate.
And if you go back to what I was talking about, how do you evaluate a good healthcare system? You don't evaluate.
I like him. He might be my favorite.
Yeah, I like him.
Evaluated by the share of government in the system. You evaluate it by whether patients want the care that they get and whether the care that patients get is worth it. I think that other countries have great hospitals, cover a lot of medical treatments, have fantastic doctors, and at the same time, they have not figured out a bunch of things that we have not figured out. So if you are the kind of person who's going without health insurance in the United States,
I hate to say it, but I think they are better off in many other countries than here in the US.
But for a
Right. That's exactly what I was saying. Like when you get 65, 70 years old.
Oh, right.
When you know, that's what the universal health care system is for, I believe.
Mm-hmm.
To take care of people that can't help themselves.
Yeah.
A lot of diseases for a lot of people, regardless of income, this is probably the country where you would like to get your health care.
Yeah, that's a good point too. That's a good point.
In America?
Yeah. He's saying if you have, because they probably have, is he saying they have more advanced healthcare?
I mean, I don't know. I know there's places like in Madrid, Barcelona.
Yeah.
They're advanced as well. There's a place in Asia somewhere that they have completely advanced.
Yeah.
More than even the United States. So I don't know. Or is that just what we've been always told?
Well, I can say from our personal perspective, the cost has been less. We've had to use our health insurance multiple times since we've been here.
Here in Spain.
It's been very seamless. It's been great. We've gotten personal attention when we needed it.
Mm-hmm.
And the treatment's been amazing, like stuff that we haven't even, thought of before. So I don't know. It's definitely a interesting debate, but I thought this was good.
This is a good one. It's a good one.
Yeah,
I like it. Yeah, I like those
Yeah.
professors.
I was trying to find somewhere I could be funny in there, but that was kind of serious. Yeah. All right, let's see. Let's see what we got here. Okay. Of course, we got to, let me see. Remember Reddit somewhere where a particular person had attended a healthcare symposium. The speaker had said, paraphrasing, America's healthcare system works exactly as it's intended. It's just not intended for the benefits of the patients. Oh, dang.
Ooh, that's a good one.
Dang, that's tough.
Boom, in your face.
Oh, whoa. Let me. All right. I scoff when Americans talk about waiting times. My American friend was diagnosed with a heart defect. That diagnosis leaving him with a $16,000 bill he will never pay. And it took Medicare 2 years to approve his heart surgery.
Ooh.
Some people don't make it 2 years. Had a heart attack in New Zealand at 5 p.m. 2 stents were installed by 8 p.m.
Whoa.
The only cost, the parking fee for my wife visiting me.
Oh,
Universal health care is great.
Wow. I love stories like that.
Yeah. Yeah. So
it's those kind of stories that when we were living there in the United States that pushed us to make the move.
Yeah. Well, we know this can be a hot topic. So people that are in a place where there's universal health care, if you have some thoughts behind it, maybe you don't think it's a good system, I mean, let us know, because we definitely, the people watching this, I'm sure they probably have would like to hear your opinion on it as well. So anything else?
No.
All right. Well, I think that was a good one.
Yeah.
You picking good stuff. You're doing good. Okay. Thanks for stopping by.
Bye.
Peace.